So let's go here. Let's go full screen. And this will be the review for the bone test 2. So I just have a bunch of slides, and I'm going to just kind of go through things as I see them and try to incorporate most of what we've talked about. There can be other slides that could show up on your test, but this should be a fairly good representation of what to expect. So if you see this is a type of ossification. Remember, there's only 2 types of ossification. That's how does a bone develop. So this is intramembranous ossification. So this is developing straight from the mesenchymal cells. See the mesenchymal cells? This is probably in the dermis. And so here's the spicule developing. You can see the osteoblast with the lacuna starting to form around them. Here's like a mesenchymal cell turned into an osteoblast. And so once you get a lacuna, then it's called an osteocyte. Don't forget. So a young one like maybe this guy is not quite developed. That osteoblast. And then as they get lacuna, they're osteocytes. Now don't forget, each and every spicule is surrounded by endosteum. So that's the cellular layer. So that's probably developing endosteum right there. So this one, flat bones of the skull develop this way. So I generally stay real specific. Flat bones of the skull. What type of ossification does that use? Then you would go intramembranous. Okay. Oh, there's a blood vessel probably getting trapped in there. Looks like a vein. Can't swear to it. This is probably this looks more like what under our microscopes in the lab. So this is a flat bone of the skull. It's probably like a frontal bone or something. You can see it's got a little curve to it. And so here's the spicules forming in the middle here. And then this is some really beautiful mesenchymal cells. So I don't know why, but they look like they have a little tail on them. They almost look like little triangles or little kites. If you zoom in really close. That other one, we were zoomed out a little bit more. But you can see the spicules forming. You can see lacuna are starting to arrive. So this is going to end up being spongy bone, and it'll remodel towards the outsides of that flat bone of the skull, and you'll get compact. Those are types of bone, spongy and compact. What we're talking about here is what type of development. And this is intramembranous ossification. This is endochondral ossification. So this is a long bone. So this could be, who knows, what kind of long bone, tibia, whatever. So if you notice, all this is hyaline cartilage. So endochondral ossification, the mesenchymal cells turn into chondroblast first, and then they become chondrocytes trapped in lacuna. And here's an example of that. This is going to be a growth plate, by the way. So this is a long bone developing, so it's growing in that direction. You can see the little spicules are getting laid down here, so that's becoming spongy bone. Right? And you're zoomed in pretty close, so you can see the hyaline cartilage, but you just got lots of hyaline cartilage here, so boom, that's endochondral ossification. I've never figured this slide out. I don't know if this is like a humerus and the secondary ossification center fell off of it, or if this is going to be like a tibia that kind of dipped in on the tops like this, and maybe the secondary ossification center may not have formed yet. So I have no idea. But I do know this is a developing long bone, and that it's endochondral ossification. This is the same thing. This one's growing this way. This is all hyaline cartilage, but you're zoomed way out. So here you're zoomed in, so you can see it. I like this better. But this is kind of nice because you can see where the plate is going to be right here. The growth plate or the epiphyseal plate. And then you can see the spicules developing down here. Right? So spongy bones developing down here. So you see all that cartilage. So boom, it's endochondral ossification. This is a really pretty beautiful one too. There's a bunch of hyaline cartilage. You can see the what's going to be the epiphyseal liner plate, and then here's some spicules forming, and you can see this is a long bone. forming. Okay. Looks pretty nice. And if you look close, you can see the chondrocytes or the lacuna are swelling up, and then they will die inside of there. And then blood vessels, for our intents and purposes, are going to bring in osteoblast, and then it's actually probably a precursor to an osteoblast, but whatever. Brings in osteoblast, and then that's going to the osteoblasts are going to start making these bony spicules, and they'll eventually become osteocytes trapped in lacuna, and then here's going to be your spicules, and then it'll remodel the compact on the outside, spongy on the inside. That's just showing you where a line would be. I doubt I'd show that. It's a tendon, by the way. Just don't forget dense, regular connective tissue. That's all I can ask you about tendons on this test, because tendons connect muscle to bone. But there's a bunch of collagen, right? It's probably pointing at a nucleus of a fibroblast. It's probably pointing at a collagen fiber here. Now, this is, if I ask you, what type of bone is that? You just go spongy bone. That's all you know. It's only two types of bone, right? Spongy and compact. Well, that's obviously spongy. That's a spicule. You can also call it a trabecula. Trabeculae, AE is plural. And if I asked you, how did this develop? Guess what? You can say, I don't know. And you can actually get credit, because there's no way to know. We don't have enough information. So you don't see hyaline cartilage anywhere. You don't see mesenchymal cells anywhere. This is already pretty much done. You're even getting red bone marrow developing here. This is probably mostly fat, so I'd probably call it yellow bone marrow. So it's no way to know, because you're zoomed in. All you see is a spicule, and you have no other clues. So all you know is this is spongy bone. Have no way to know how that developed, unless you physically knew which bone you were looking at. And you can see lacuna starting to form. Oh, look, you got a blood vessel trapped in here. It's kind of cool. It's a beautiful slide. This is compact bone. So on the periphery, of a long bone, and on the periphery of the flat bones too, for the most part, or pretty much. Then you have compact bone. So compact bone is going to look like this, and it's going to look like a tree ring. When you cut a tree down, you see the rings, and in the trunk. And so this is going to look very much like that. So from here to here, you can see that circle, right? That's called an osteon, O-S-T-E-O-N. So an osteon is a structural unit of compact bone, okay? So if you see this, you see a bunch of tree rings, basically, under your microscope. I'll say, what type of bone is that? You go, boom, compact, right? Do we have some other structures? Yeah, the rings themselves are called lamella, right? And a lamella, A-E, lamellae would be plural. It would be nice on this one if you said concentric lamella, because they're in concentric circles. These little spaces, those are also called lacuna, lacunae, because bone has lacuna too, not just cartilage. But inside of the lacuna in the bones, you have osteocytes, not chondrocytes. Chondrocytes are in cartilage, right? Here's your central canal. The old name was Haversian Canal. I don't care. Either one. Central canal is easier to spell. And then you got the little perpendicular cracks radiating out from the central canal, right? Well, don't forget you got blood vessels in here. And so you got to get nutrients out here to the lacuna so that the osteocytes can, live. And so, I know there's little cytoplasmic extensions inside of these cracks, but we're keeping it kind of simple. We're not going that deep into the microanatomy. Just know that stuff can flow through these little canaliculi, and so you can get nutrients to your osteocytes within those lacunae. All right, this is pretty beautiful. So we took a bone and we sectioned it, right? And so now you can see the spongy, see the way it looks like honeycomb, right? And then towards the outside, the periphery, remember, superficially, you're going to have compact bone. Deep, you're going to have spongy bone, right? And so these two little guys are pointing at compact bone, right? the hollow area right here, that would be your marrow cavity. You can also call it your medullary cavity. Right? There's the head. This is a femur, by the way. There's the head of it. There's the neck. And you can see greater trochanter, lesser trochanter. You're looking at the back of it here, so you see the linea aspera. That means rough line. And then let's just name some landmarks, because you should be familiar with these by now. So you know this is medial. And so this would be medial condyle, lateral condyle, intercondylar fossa. And then that would be your epicondyles, medial and lateral epicondyles. So on the ends, you have this articular cartilage on the head up here, right? Also on these condyles, it's going to be cartilage, hyaline cartilage, same thing, articular cartilage. Now, you can barely see the edge of it, but that little dip right there, it's kind of like a little hole. It's almost like, it looks like a little volcano almost, but blood vessel goes in there, blood vessels go in there. And so that's called the Fovea Capitus is the old name. Your book may call it something like Fovea for ligament of head, but Capitus is like a little skull cap, you know, so I kind of like that term. It's a nice x-ray where you can see a growth plate, right? You can also see a growth plate here. So this is somebody that's still young, still growing. And so don't forget you have cartilage in there, right? And then this is obviously a synovial joint. You can't really see the capsule, but all this area would be filled with synovial fluid, you know, in that capsular space. So here's just some general stuff. And oh, look at all the stuff I could point at. So here's an epiphysis. This looks like a tibia. See the medial malleolus, right? And then here's your condyles up here and your intercondylar eminence right here. So this would be your growth plate or line. If you're an adult, it's going to be called a line because it's not very thick. If you're still growing, you know, you're young, it'll be that you can call it a growth plate, but it'd be epiphyseal plate is the correct term. Any epiphyseal line, that would be the correct term for an adult. You can see the marrow cavity. You see the epiphysis. This will be the proximal epiphysis generalized in. This would be the distal epiphysis generalized in. And the diaphysis is just the shaft. Shaft is half point, diaphysis whole point. Now, I know in your book it calls this an area also called the metathesis. I couldn't count you wrong. If I pointed at the epiphyseal line and you said metathesis, I can't really count you wrong because that's the area that the epiphyseal line or plate is in. This is the periosteum. Peri means around, osteum's bone. So it's mostly collagen. Kind of looks like that slide, you know, that we showed you of a tendon almost. And underneath it, there is a cellular layer. So it's kind of a double layer. You have collagen on the outside. You have a little cellular, you know, layer on the inside. But this does have receptors in here, pain receptors. So if you're giving somebody a shot and you bump the periosteum with your needle, they're probably going to feel it. Okay, so be aware of that. This is showing you a nutrient vessel going in. You'll have more than just one. But remember, bone's a living tissue, so it needs a blood supply. Okay. This is just a little better drawing. So this is just showing you basically the same thing. It's just colored in a little better. There's your epiphyseal line. They drew the metaphysis kind of thicker, but whatever. Distal epiphysis, proximal epiphysis, articular cartilage, marrow cavity. Don't forget your marrow cavity is covered on the inside with endosteum. Remember, that's the cellular layer around each and every spicule. Well, guess what? It's also inside the marrow cavity. Guess where else it is? Bonus! It's inside each and every central canal. That's lined with endosteum also. That's kind of a bonus question. All right. So there's our periosteum. They kind of pulled it away so you can see it. There's a nutrient artery. There's our articular cartilage. This is a humerus, not a femur. So there's the head, right? No fovea in the head of this one. So don't get those bones confused. Here's your condyles. Actually, your book's calling this all one condyle now with 2 parts. They're calling this, with this one on the lateral side, the capitulum. See the way it looks like a little bitty skull cap? And then this one kind of looks like a spool of thread with no thread on it, or a pulley. And that's trochlea. I learned it 2 separate condyles, and it's a lateral condyle, medial condyle. The lateral condyle was called the capitulum. The medial condyle was called the trochlea. But your book has changed that, and they're just calling the whole thing one condyle with 2 parts. Whatever. There's your medial epicondyle, and there's your lateral epicondyle. Okay. This is just showing you your axial skeleton is in green and your appendicular skeleton is in purple. You should know these bones by now, you know, like humerus, ulna, radius, your coxal bones, which is composed of your ilium, your pubic bone, and your ischium. There's your femur, there's your tibia, there's your fibula. Make sure you spell those right. There's your patella. Make sure you know the bones of the hand, and clavicle, and the scapula, and the mandible, and the frontal bone, parietal bone, temporal bone, occipital bone, mandible, you know, all those guys. We can't really see them from here. Can't really see the hyoid, you know, but true or false, the hyoid's a fixed bone of the skull. False. Just tendons and muscles are holding it in place. You can see the sacrum. Can't really see the coccyx. But anyway, we'll go over a lot of these. And there's a good slide for you to look at. But that's it. A lot of what we were just saying. Just make sure you're familiar, right? You got your talus. You know, they're leaving some bones out down here. But you got metatarsals versus phalanges. Up here you have carpals and metacarpals. And then you have phalanges, right? Everything else we've pretty much talked about. Okay, don't forget on the sternum you have 3 parts: manubrium, body, xiphoid process. Here's your ribs. You got 7 true ribs on one side and 5 false ribs below that. Of the false ones, you have 2 floatings. Okay, so the bottom 2, 11 and 12, are considered floating ribs. There's no cartilage connecting them up here to the sternum. Okay. Glenohumeral joint. If I just said, name that shoulder joint, what's its name? You go glenohumeral joint. Okay. So the glenoid cavity is right in there. I learned it fossa, but whatever. So I think glenoid, if I remember right, it means socket. Here's the acromion process, or you can just say acromion, that's fine. And there's the coracoid process. There's your clavicle. There's your humerus. Here's a subscapular fossa of the scapula. I'm never going to ask body of the scapula. But if I say, what's this dip against the ribs? You go, subscapular fossa. Oh, this is beautiful. You can see this is the back of the scapula now. And so there's our spine. There's our scapular spine. Remember, a spine doesn't always look like a spine, doesn't always look like a spine. Got to kind of use your imagination. And there's your acromion, which is articulating out here with that clavicle. So the dip above the spine, I love the way they named this, supraspinous fossa. What's the dip below the spine? So, sorry, I almost messed up. Infraspinous fossa. Got to kind of use your imagination. Medial border. You can also call it vertebral border because you're not that far away from your vertebra. Lateral border. You can also call it axillary border. You remember the armpit is axilla. And then the superior border, of course. There's an inferior angle. I pointed at that. Okay. I can't really see them, but above this glenoid cavity and right below it, there's going to be little bumps. It's going to be a supraglenoid tubercle up there and an infraglenoid tubercle down here. Can't see them on here, but those are important. And later on, because some muscles originate from there. You know, a muscle, one of your biceps muscle, biceps brachii muscle, originates from the supra glenoid tubercle, and one of the triceps on the back of the arm. One of the heads of the triceps originates from the infra glenoid tubercle. This kind of blurry, but it's just showing you the radius. Here it is kind of facing you. There it is turned around. Same thing with the ulna. It's showing it facing you, showing it turned around. There's the humerus, right? We kind of looked at that already. It's just showing it from 3 different views. It's kind of blurry. Not too crazy about that. There is the radius. It seems like it's kind of turned away from us, but there's the radial tuberosity, which is generally facing more anterior. There's the radial head. It looks like a little radial tire. Where that fits in on the ulna, it rubs a notch, and that ends up being the radial notch. I'm not 100% sure that this radius goes with this ulna. They might have the wrong side here. But anyway, it's kind of hard to tell when you're looking at a 2-dimensional thing. There's your trochlear notch. There's your olecranon process. This it's hard to see, but this is poking up, right? That's the coronoid process. There's a little, you can't really see it down here too good, but there's a little styloid process that pokes off of here. There's also a styloid process that pokes off of here on the radius. So that would be styloid process of the ulna, styloid process of the radius. There's a little notch that's rubbed here, and it's on the radius, so the ulna is rubbing it, ulnar notch of the radius. Where up here you have the radial notch of the ulna. Now this is the head of the ulna. Notice head has nothing to do with top and bottom, right? So don't get thrown off by that. This head happens to be at the bottom. This head happens to be at the top. All right. I kind of like to show these probably from this view, the palm view. And so this is the scaphoid. That's the lunate. That's the triquetrum. And this is the pisiform. I've heard it pronounced pisiform, but I say pisiform. And then there's a trapezium, trapezoid, capitate, and hamate. So there's a little saying, she likes to play trumpet to comfort herself. And that's a mnemonic, when you look at that. But you got to go in those directions. You go this way across. She likes to play trumpet to comfort herself, that way across. Okay. So anyway, you're going to just have to sit down and memorize those, because I think nursing school wants you to know all of them now. Back in the old days, we would mainly just teach scaphoid, lunate, and capitate. Because say you fell down on your hands, on your palms, sometimes you can crush these guys, and so I kind of concentrated on the ones that got injured a lot, and that was scaphoid, lunate, and capitate. You say you ram your hand or your fist into the wall, something like that, you can break that capitate. I mean, any of them can get crushed, with enough trauma. But so now they want you to learn them all. Okay. All right. So metacarpals. Make sure they're little bitty long bones, right? Because they have epiphyseal lines. These are short bones down here. And the same thing, these are like little bitty long bones, because these all have epiphyseal lines and plates, right? Depending on what stage of growth you're in. So metacarpal 1, 2, 3, 4, 5. And then these are called phalanges. 1 is a phalanx. So that's distal phalanx, number 1. Proximal phalanx, number 2. Notice there's no middle phalanx in there because it's your thumb. On this, did I say 1? So distal phalanx, number 1. Proximal phalanx, number 1. Hope I didn't say 2. Then you go here, and you go distal phalanx, number 2. Middle phalanx, number 2. Proximal phalanx, number 2. Proximal phalanx 3. Middle phalanx 3. Distal phalanx 3. So you got to give me all the name, right? You got to give me the number, and you got to give me which phalanx it is, right? And if it's proximal, middle, or distal, basically. So here, this would be distal phalanx number 5. Okay, so if somebody's talking to you on the phone, they got to be able to understand exactly which bone they broke without looking at a picture. Oh, they broke their middle phalanx number 4. Then you know exactly what they broke. And I'm going to assume you know left from right at this point. Okay. Then this is just showing you the Manubrium, the body, the xiphoid process. It's not a real good one, but there's a notch there called the jugular notch. And there's also notches on either side called the clavicular notches. I have pointed at those. You know, I've done a trick question before. I go, name 3 bones that articulate with the Manubrium. It's kind of a trick question. Clavicle, obviously. First rib to the sternum, obviously. And then they're calling this a separate bone, technically. So then you would go the body, right? So, but don't forget, first rib to the sternum, right? Got one on each side. First rib to the sternum, that's a true hyaline cartilage joint. So you have a synchondrosis, right? So if I'm asking for a true synchondrosis, 9 times out of 10, I'm going to point it first rib to the sternum. Okay, in your book, I know it's a little confusing. They're calling all of these joints synchondroses here, but these they're calling little bitty synovial joints here. It's just weird. It doesn't seem to fit the pattern, so I stay away from these because, you know, this does move. And so apparently there's little capsules here. So no, if I'm asking for a good synchondrosis, that's structural joint made of hyaline cartilage, boom, first rib to the sternum. Okay. This is showing you your spinal column, well, your vertebral column. There's your 7 cervical vertebrae. Don't forget Atlas is C1, Axis is C2. Then you got 12 thoracic vertebrae, 5 lumbar, and then your sacrum is fused. I think it's generally 5 fused vertebrae that fuse to form your sacrum. Then you have a little tailbone called the coccyx, right? And so the coccyx, it's generally 3 or 4 fused little vertebrae. Oh, one thing I kind of forgot to talk about. Let's go back. 2 ribs. The cartilage is connecting straight from the rib to the sternum. 1, 2, 3, 4, 5, 6, 7 of them. Right? The false ribs, technically, your cartilage is connecting to the cartilage that connects to the sternum. That's why they're called false. At least number 8, 9, and 10. Number 11 and 12, they're still false, but they're also floating because there's no cartilage. Okay? So, just in case you were confused why they had those different names. All right, let's look at some vertebrae. There's a cervical vertebra, really beautiful picture. There's your vertebral foramen. There's your body. In the transverse foramen, you have transverse foramina. So if you see these transverse foramina out here, boom, you know you're looking at a cervical vertebra. All 7 cervicals have those, even the atlas, even the axis. Okay, this is a spinous process. It happens to be bifid. So if you see a bifid spinous process, you're probably also looking at a cervical vertebra. Okay. This is showing you a thoracic vertebra. It kind of looks like a giraffe, not this one, the next one does. But there's your spinous process. There's your transverse process. There's your centrum, you know, just like on the other one we were just looking at. Now then, there's some other things. This area is called a lamina. That area is called a pedicle. There's your vertebral foramen, by the way. This that's poking up, can't really see it that well, but it's poking up at you. Superior articular process. It has a flat area on it that they call the facet. Superior articular facet. So if you have superior articular process, does it stand to reason you probably have inferior articular processes? Yeah. Do you think those inferior articular processes have well, that's not it I'm pointing at. Sorry. Inferior articular process right here. Do you think it has a facet on it? Yeah. Look at my superior articular process. Has a facet. and there's my inferior articular process, has a facet. I almost pointed at the wrong thing over here. See these two guys? I call these something else. So they call them superior and inferior costal facets for head of the rib. So it's kind of weird. So when a rib sits here, it's rubbing half of a facet. So a rib is sitting here, the head of the rib. So it's rubbing half a facet here, and it's rubbing half a facet on the vertebra above it generally. So I call this, the old name, demifacet. So this would be a superior demifacet, D-E-M-I. So a demi means half, right? And I would call this an inferior demifacet. So if this was, say this was thoracic 5 or 6, then there would be another thoracic below it. And so you would be rubbing, that same rib would be rubbing a superior demifacet on the one below it. All right. So hopefully when you see them put together, this will all make sense. But there's pedicle, lamina, pedicle, vertebral foramen. There's the body. There's the transverse processes. And notice the way you have a transverse costal facet, because that rib, say the head of the rib sitting here, the back of it's coming around here, and then it's going up to the sternum like that, towards the sternum like that. So the back of that rib, there's a tubercle that rubs this facet. Same thing on this side. It'll make sense when you see it put together. There's this one looks like a moose. See the way this one looks like a giraffe with a long nose, right? This one looks like a moose, right? So I made a stupid saying up. You know the way a lot of times you get what they call a slip disc in your lower back. I go, the moose is loose in the lumbar region, right? Just helps me remember that the lumbar vertebra look like moose, where the giraffe lives in Thoracic Park. So then you know that's a thoracic vertebra. Looks like a giraffe. Anyway, if that helps you remember it, you know, hopefully it does. All right, there's your spinous process. There's your transverse processes. There's your vertebral foramen. Everything's the same, right? But you don't have all these costal facets because there's no ribs down here. Do you still have inferior articular facet and superior articular facet, and you know, that are on these processes? Yeah. Now there's something I didn't mention, but say this is L4 and there's an L5 below it. It will kind of seal off right here, and so it'll make this look like a foramen. It's kind of a fake foramen, but it's still a hole. So it's not going to be a notch anymore. It'll look like a hole. And that's where nerves can come out of these intervertebral foramen. Same thing here, right? So it would make an opening there, right? And so that would be intervertebral foramen. Don't confuse it with vertebral foramen. These are for nerves. That's for the spinal cord. All right. There's your sacrum. Beautiful picture, and you can see the little probe they're putting under there to show you that it's hollow under there. That's the sacral canal. Above it's the median sacral crest, right? This opening at the bottom has its own name. It's called the Sacral Hiatus. I don't know if that's where that term comes from. I'm going to go sit down, take a hiatus, you know, take a break. And you go and you sit on your hiatus, basically. So don't forget these are fused vertebrae, so you do have these processes poking up here. There's your sacral foramina, right? There's your coccyx, and there's your sacral hiatus. Now you can't see it here. I think it's on the next slide. Oh shoot. Yeah. Anyway, where this articulates with the ilium, it's going to look like an ear, so it'll go auricular surface. I think I have it on another slide. So it'll be an auricular surface. It'll look like an ear, and that's where it connects to the iliac bone, or the ilium. So here's 3 things fused together: ilium, ischium, and the pubis. So these 3 bones fuse so perfectly that you don't even get lines in there. It just becomes one bone. Okay? So if I say, what particular bone is this? What specific? You go ilium. What particular bone? Ischium. What particular bone? Or specific? Pubis. Right? What's the whole thing? All three of them together is called coxal. C-O-X-A-L. Don't confuse that with the tailbone. Coccyx, right? C-O-C-C-Y-X, right? This is coxal. Okay. Now let's look at some other things. Greater sciatic notch. This right here is called the lesser sciatic notch. The spine on the ischium is called the ischial spine. Now, be careful. You got 4 spines up here. You can't see them that well, but that's 1, 2, 3, 4. You can just name them by position. They only named one of them. Anterior superior iliac spine. Well, that's what make this one the anterior inferior iliac spine. This would be the posterior superior iliac spine. This would be the posterior inferior iliac spine. Now, what is this? That's where the head of the femur goes in there, right? It's called the acetabulum or acetabular cavity or fossa. I think your book says fossa. I learned cavity, whatever. That actually means, so like vinegar, you know, in chemistry, vinegar is acetic acid. So this actually means in Latin vinegar cup. So it's probably from the Bible, you know, the vinegar cup. All right. Remember, these things were named a long, long time ago. Here you flipped it over. So you can see the ear-like shape, right? So that's the auricular surface on the ilium. You have a matching auricular surface on the sacrum, but we just couldn't see it, okay, on that other side. Don't say articular surface, even though it is technically, but you'll only get half a point, right? So auricular surface is your fossa, iliac fossa. There's your crest. There's your 4 spines. Boom, 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 boom. There's your greater sciatic notch, lesser sciatic notch, ischial spine. Oh, I almost forgot this. Looks like an O. Obturator foramen. Okay. This tuberosity, broad-based bump. It's the butt bone. Don't call it the butt bone. You won't get a half a point. That's the ischial tuberosity. Do you have an ischial ramus? Ramus means branch. Yeah. Do you have a inferior pubic ramus? Yeah. Do you have a superior ramus on the pubis? Yeah. Do you have a crest? You know, pubic crest? Yeah. Do you have a pubic tubercle? Yeah. Do you have a pubic symphysis, you know, right here? Or remember the fibrocartilage structure that goes right in between these two? Yeah. All right. What is this? It looks like an arc. The arcuate line. So if the pelvis was put together, the pelvis being both coxal bones, the sacrum, the little coccyx, and then the pubic symphysis, all that put together, then you call that the pelvis. Okay. All right. Let's look at the femur, head, neck. Okay. Remember on a humerus, you had head, anatomical neck, and then you also had a surgical neck. So don't get these things confused. There's some commonalities, but not really. So this is a head. You can't see the little Fovea Capitus in there too well. Anyway, there's greater tubercle, lesser tubercle. Diaphysis or shaft. There's patellar surface. Condyle. Make sure you know that's medial, that's lateral. Medial epicondyle, lateral epicondyle. Just flip him over. Beautiful. So now you see this is the linea aspera. A-S-P-E-R-A. Means rough line. There's my greater and lesser. Did I say tubercles? I hope I didn't. Those are trochanters. So greater trochanter, lesser trochanter. I can't remember. Scratch it if I accidentally said tubercles. That's a very common mistake, right? On your humerus, you have tubercles. On this, you have trochanters. Don't make that mistake. I don't want to have to re-record this whole thing, so hopefully I did not make that mistake. If I did, scratch it out. Okay. This in between the trochanters is a crest on this posterior side, so it's an intertrochanteric crest. Okay. You also have an intercondylar fossa right here. So that's about 13 things if you count them up. And it should all be in your lab book or your study guide. Fibula, make sure you spell them right. Condyle. You know this is the medial side because that's called the medial malleolus, right? This would be the medial condyle, lateral condyle. This would be intercondylar eminence that's poking up into that fossa, remember? This is a tibial tuberosity, right? Okay. And here's the anterior margin or crest. There's your medial malleolus. Over here on your fibula, make sure you spell it right, is your lateral malleolus. There's your diaphysis, and there's the head. Okay, here you're looking at the back. Oh, it's really nice. You can see the interosseous membrane. That's the structure. What kind of fibrous joint is this? Syndesmosis. Remember, you got 3 different kinds of fibrous joints. Remember? So the suture joint in the skull is called a sutural joint. The tooth in a socket is called a gomphosis, and then in between your radius and ulna, or your tibia and fibula, is called syndesmosis. So those are 3 different kinds of fibrous joints. Now this is nice. So there's your talus. There's your calcaneus. We're talking about these tarsal bones here. This is the navicular. See the way it looks like a little canoe or a boat? Navy is from the same root word. That looks like a cube, so they call that the cuboid. These 1, 2, 3, these are cuneiform bones. Make sure you know lateral from intermediate from medial. Okay, lateral, intermediate, medial, cuneiform bones. These are your metatarsals. You count from the big toe side. Number 1, number 2, number 3, number 4, number 5. And do we still have proximal middle distal phalanx on the little toe? Yeah, proximal middle distal, proximal middle distal, proximal middle distal. And be careful on the big toe. You only have a proximal and a distal. Now, ligaments. So, on ligaments, sometimes you can name which 2 bones are connecting and get away with it. It doesn't always work. Because look at here. That's connecting the coracoid process on the scapula to the acromion process on the scapula. Well, you can't go scapular ligament. That makes no sense. So you have to name them by the landmarks. So you go coraco-acromial ligament. Here you're going acromio-clavicular. So you name landmark to bone. Here you're going coraco-claviculars. Kind of got 2 heads here. And same thing, landmark to bone. What if I run out of things to point at on here? Don't forget glenohumeral ligament here. Ligaments here. All right. Oh, there's bursa too, by the way, filled with synovial fluid. This is a really good drawing. So they kind of cut into the vertebra here. But you can see the anterior longitudinal ligament on the front of the bodies. You can see the posterior longitudinal ligament on the back of the bodies. In the roof, you got, it kind of skips. You got, little intermittent ones. And it's called the ligamentum flavum. Sounds like a scoop of ice cream at Baskin-Robbins, doesn't it? And then back here on the spinous processes, you have the supraspinous ligament. And in between the spinous processes, you have the interspinous ligament. Okay. Now that supraspinous goes all the way up. Let's go all the way up, all the way up, all the way up. Then you end up hooking to that external occipital protuberance on the back of your occipital bone, right? And so that's got its own name when it does that. It's the ligamentum nuchae, N-U-C-H-A-E. So that just means neck. Nuchae means neck. Okay. I love this colored in. So you got iliofemoral ligament. It's kind of in 2 heads. And then under here, you get the green one. You got the pubofemoral. So notice these are just naming which 2 bones they connect. It works on this one. And then this one is ischio. This is the back. There's your ischial tuberosity, by the way. So that's ischiofemoral ligament. Notice the way it's really nice. It just named which two bones they connect. They all connect to the femur, so every one of them has femoral in the name. Okay. Here's the knee. You're looking at the front, right? So that's your anterior cruciate ligament. And behind it is posterior cruciate. You see the way they're kind of crossing over each other? That means cruciate means cross. That's probably, same root word as crucifix, which means cross. Okay. Then you have a ligament on this medial side, so I call this the medial collateral. And you have one on the lateral side, I call that the lateral collateral. Okay. Do you have two menisci? Meniscus is singular. Yeah. Medial meniscus, lateral meniscus. Okay. Then if you looked on the back, you could see that PCL. So don't just give me the ACL, PCL, MCL, LCL, unless you've already named them once, then you can. Okay. Here you can't see the ACL because this is in the way, but this is your patellar ligament going from your patella to the tibial tuberosity. Here's your lateral meniscus, your medial meniscus. There's your MCL, assuming you've already spelled it out once. And here's your LCL. Now, in your book, they're trying to call this the tibial collateral, which makes sense. It's on the tibia. They're trying to call this the fibular collateral, which makes sense. Those are hard to spell, right? I just go medial and lateral collateral. Almost everybody else does too. There's your PCL, by the way. Don't get confused with these fibers that are coming off of this meniscus here. That doesn't count. But this one going straight up and down, that's your posterior cruciate. Okay, ligament. Now, what about your ankles? So this on the side. Let's look at the easy one first. This on the inside. This is a really thick, tough guy. And it looks like a river delta spreading out. You don't need to know this individual, pieces of it. Just all of that. If I put the tape there or a pointer there, then you go deltoid ligament. That's what everyone calls it. Okay. Because it looks like a river delta. It's pretty tough. But if you do a really bad eversion injury, where the sole of your foot goes out, you can stretch or tear it. Same thing here. You can do an inversion injury where the inside, where your sole goes to the inside, and then you could tear these up because these are not nearly as sturdy. But you can see right there is your calcaneofibular. All you did was name bone to bone. You got it. Okay? These are talofibulars, but that's only going to get you half a point because you got two of them. So you got to say anterior talofibular, posterior talofibular. And it's not that great, but you can see it is a long plantar ligament under there. Right? And then I think there's some fascia that goes across here too, and that's how people get that. When that gets inflamed, it's called plantar fasciitis, but it's not showing on here. And then that's just showing you your femurs and your tibia and your fibula. And so that's pretty much everything. We just didn't put much of the skull on here. So make sure you look at the sutures on the skull, like your sagittal suture, your lambdoid suture, your squamosal suture. Make sure you look at the fontanelles on the baby skull. Remember the soft spots, anterior fontanelle, posterior fontanelle, anterior lateral fontanelle, posterior lateral fontanelles. Then look at all those structures, when you take the skull cap's called the calvaria. When you take all that off, then you can see down inside of there, and you can see anterior cranial fossa, middle cranial fossa, posterior cranial fossa. You can see the foramen magnum. You can see the jugular foramen and the carotid canal. You can see the ethmoid and the little cribriform plate. Remember those guys? It's all on that skull lecture, so you'll have to review that. I couldn't put everything on here. We'd be talking all night. Then don't forget the two things that make up your zygomatic arch, like your zygomatic process of the temporal bone, temporal process of the zygomatic bone, right? Don't forget your mandibular mandibular fossa on your temporal bone that the head of the mandible sits in, right? Don't forget your mastoid processes and styloid processes hanging down from underneath the skull. Don't forget your coronoid processes on your mandible. Your condylar, mandibular condyle, is also called the head of the mandible. Mandibular ramus, mental foramens, right? can't see any of this from this view. Intermaxillary suture, frontonasal suture, internasal suture, right? All of that stuff's fair game. 7 bones of the orbit. Remember that? Please feed my zebra. Let's see if we have an orbit. Right? Please feed my zebra. Palatine, which you can't hardly see in there. L is lacrimal, where the tears drain. E is ethmoid, which you can't really see. S would be sphenoid. Remember, you got your superior orbital fissure and your optic canal on that, right? In your, don't forget your little sella turcica where the pituitary sits. And then what else on the skull? There's your intermaxillary suture right there, by the way. Little mental foramens would be there and there. Inside, on the tongue side, don't forget your mandibular foramen, right? Because that's really important, especially if you're going into dental. You're going to be doing nerve blocks right there to numb up that part of that lower jaw. What else? Your septum, nasal septum. Remember, that's going to be your perpendicular plate of your ethmoid and your vomer. You can just barely see the superior orbital fissures there. Don't forget your nasal bones out here. They're not part of the orbit. There's a hyoid bone under here that's not really part of the, it's not articulating with any of the bones, you know, of the vertebral column or the skull. Just kind of floats. I think we're good. All right. Whew. That's a lot. There's still, you know, we can't cover every little thing, but just go over all the lectures. Okay. So I'm going to put this on YouTube for you. Okay.